Hello. So today my topic is about first aid in burns and frostbite. So I will discuss about the steps that I used for the first aid in burns and frostbite. So here comes the first step. What we have to do is cool burnt area with cold water. Cold water is the best immediate treatment for minor burns as it helps in reducing the temperature of the skin and also assists in cleaning the affected area. Note that do not use ice because it may further damage the injured skin. Then the second step is avoid touching the wound with bare hands or unsterile objects. Avoid applying the basic things such as the butter, ghee is a kind of butter, or any oil as it increases the chances of infection. The third step is do not break blisters that may develop. If blisters break it clean the area by running tap water over it. Apply an over the counter antibiotic or burn ointment. Then the fourth step is leave the burn alone for 24 hours. Don't cover the burn unless clothing rubs on it. If it rubs, cover it with the gauze pad, pad taped well away from the burn. Remove the dressing every day and clean the wound cover and cover it again. So the main steps or say the basic things that we should do is remove the sores, then run water over the burn, then apply a sterile bandage, monitor the burn. If the blisters develop, do not break them, and also see the tetanus shot. It should be updated. If it is not updated, contact the physician. Now we have the first aid for frostbite. As you can see in the picture that it shows the 3 degree of the first the frostbite. See, in the first degree you can see it irritates the skin. Second degree blisters but have no major damage. Then the third degree it involves all layers of the skin and causes permanent tissue damage. So these are the basic steps that you use in the frostbite. I will explain you one by one all of them. So firstly, what is frostbite? Frostbite is when skin and the underlying tissues freeze after being exposed to very cold temperatures. The areas most likely to be affected are the fingers, toes, ears, cheeks and chin. Early signs of frostbite are numb, pale skin, pale, pale patch of skin or skin that feels hard or loose looks waxy. You can treat a mild frostbite with first aid. All other frostbite requires medical attention. So the first aid steps goes are first check for hypothermia. Get emergency help if you suspect hypothermia. Signs and symptoms of hypothermia include intense shivering, drowsiness and muscle weakness, dizziness and nausea. The second step is protect your skin from further damage. If there is any chance the affected area will freeze again, don't thaw them. If they are already thawed, wrap them up so that they don't refreeze. Get out of the cold. Once the third step is that get out of the cold. Once you are indoors, remove wet clothes and wrap up in warm blanket. Take care to not break any blisters. The fourth step is gently rewarm the frostbitten areas. So soak the frostbitten area in the warm water. It should be about 99 to 104 degree Fahrenheit. Then the next step is drink warm liquids. As such, tea, coffee, or soup can help warm you up from inside. Then consider pain medicines. If you are in pain, consider an over-the-counter pain reliever. Then the last step is know what to accept as skin thaws. If skin turns red and you feel tingling and burning as it warms, normal blood flow is returning. Seek medical help if numbness or pain persists during warming or if you develop blisters.